It's bad enough to have bursitis in one hip, but it's even more annoying when you have it in both hips, especially if it keeps you from sleeping at night, because no matter which side you roll over on, your hip hurts. I'm Dr. Dave Candy, and in this video, I'm going to explain how to relieve hip bursitis, particularly if you have it in both hips. Now, whenever I hear of people complaining of symmetrical pains, where it's the same on both sides of the body, whether that's hip bursitis or plantar fasciitis, it always makes me think of a central problem. It would be very coincidental to have the same problem just start happening on both sides of the body at the same time. And it's much more likely that there's a central cause that's triggering both of them. In the case of hip bursitis, that's often a lower back problem, particularly the L4, L5, and S1 nerves, which make up the superior gluteal nerve. That's the nerve that innervates the gluteus medius and gluteus minimus muscles, the muscles that run over the outside of the hip. And often hip bursitis pain is not truly the bursa that's inflamed, but rather it's an irritation of the tendons that run over the outside of the hip and the bursa. But regardless of the cause, if those gluteus medius and gluteus minimus muscles are weak, they cause your hip to drop out to the side when you're standing on one leg or when you're walking, and that rubs the bursa and the tendons over the outside of the hip. Now, it's a good idea to do strengthening exercises for the gluteus medius and the gluteus minimus muscles if you have hip bursitis. And we'll go through those in a bit, but all the strengthening exercises in the world won't make a difference if the signal isn't getting from your brain down to your hip muscles to tell them to turn on. And so if your nerve roots are getting pinched in the lower back, that can prevent the signal from getting to your hips. And so one really important thing to do is to make sure that you're not standing with too much arch in your lower back, or that you're not walking with too much arch in your lower back. That can put extra pressure on the nerve roots in the lower back and make the hips weaker. That means that every time you take a step and put weight on one leg, your hip's going to drop down to the side and start rubbing over the bursa or the tendons on the outside of your hip. So just standing with a pelvic tilt like that when you're standing for long periods of time, and then keeping your abdominal muscles tense when you go to walk, is a good thing to do to help you relieve pain from hip bursitis. That'll help give the nerves space to move so that the signal gets from your brain down to your hip muscles to tell them to turn on when you're going to walk. Now, additionally, it's really important to conscientiously think about turning your hip muscles on when you go to take a step so that you don't drop out to the side like that. And one good way to do that is just to think about every time you put your foot down on the floor, on the symptomatic side or on both sides if it's both hips, to squeeze the butt muscle on that side, load your weight out over that foot, and then take a step. Then you're going to squeeze the butt muscle on the opposite side, load your weight out over the opposite leg, and then take a step. And so on and so forth. And so you'd repeat that over and over and over. Now, that's not easy to do when you first start out. It's really going to be a conscientious effort for probably up to 2 months. Research shows on average it takes about 66 days to form a new habit, but that can be as little as 2 weeks or as long as a year. So you may have to really think about it until it becomes your new habit. Now, as far as strengthening exercises, what exercises help to strengthen the gluteus medius and the gluteus minimus muscles? Well, some of the common ones that people do in physical therapy are exercises like clamshells or side-lying leg raises. And I've got another video with hip strengthening exercises and common mistakes that people make when doing those exercises. But laying down exercises aren't the way that your hips function in normal everyday life. So it's much better to do single leg standing exercises where you're standing on one leg and trying to keep your pelvis level over your hip, shooting for 10 seconds or longer. Now, once you can do that, you can start to progress into mini squat exercises where you're still balancing over one leg and then you're going up and down, and that helps control both the forward to back motion of your leg as well as the side to side motion of your leg, which is really important to keep your pelvis stable over your leg as you're walking and going up and down stairs so that you're not rubbing your tendons and your bursa over the outside of your hip. Now, another really common problem, like I mentioned at the beginning of this video, is that people who have hip bursitis on both sides often have a lot of trouble sleeping because they roll over on one side and then that hip starts to hurt, and then they roll over on the other side and the other hip starts to hurt. So here's a tip to help you sleep better at night if you have hip bursitis on both sides. Now, what you'll need for this is 2 pillows and 1 small pillow or a folded towel. You're going to lay down on your side and put 1 pillow between your knees, 1 pillow underneath your head, and then the small towel is going to go under your waist. Most commonly, the people who get hip bursitis are women with a wider pelvis, and that means when you're lying down on your side, there's a gap between your waist and there's a pinpoint pressure over the hip bone. And then this top leg is hanging over the top where the tendons are stretched over the hip of the top leg. So you may need to even double up the pillow that's between your knees like this, and then rest your head on this pillow, and then you fill the gap between your rib cage and your hip bone with the small towel. This will help you sleep more comfortably at night without as much pinpoint pressure on the bottom hip and without this top leg having the tendon stretched over the outside of the hip. Now, one other common treatment that people have for hip bursitis is having a cortisone injection or a steroid injection in their hip. And those largely are usually fairly effective, but there are some negative side effects to cortisone if you have them repeatedly. Now, there is an alternative treatment that we use in physical therapy called dry needling, where you take a little acupuncture needle and you put it in the muscles in the side of the hip. And the mechanical stimulation of that needle without any medication helps relax trigger points or knots in the hip muscles and often gives nearly immediate relief from hip bursitis symptoms. So if you've tried the tips in this video and you're still having hip bursitis symptoms, I would suggest reaching out to a physical therapist in your area who does dry needling to see if you're a candidate. And if you're in the St. Louis area, we'd be happy to help you out here at More for Life. Now, no matter where you're watching this from, we do have lots of other tips on how to relieve hip pain in this playlist right over here. But before you go check that out, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.